And we are back continuing our special Eye on Health segment, answering your questions about the coronavirus.
I'm Dr. Imran Qadeer, Chief Medical Officer at Allegheny General Hospital, is here, and he's going to tell us a little bit more about the fact and fiction. And so we wanted to ask first in the second segment, we're going to rely a lot on our hospitals and facilities to help us through this. So what is AHN doing to prepare?
Well, AHN and AGH has done a lot. We've worked with CDC, our local health department, state department, and on our preparedness plan. We have screening questions at all of our access points, including emergency department, physician practices, urgent cares, home care, etc., where there's screening questions of patients if they have fever, cough, and shortness of breath. Those patients who have concerns for coronavirus are then isolated by CDC guidelines. They're quarantined in airborne isolation.
Yeah. Okay. So this is all part of the preparedness plan.
Yes, yeah. And so there's additional preparedness plan where if the patient is isolated, then the caregivers have to wear protective equipment. We have treatment plans that are being discussed, and everyone's educated around it.
Sure, you have to protect yourselves too, or you can't help anyone else.
Right.
All right, Marcy is asking a question. If you have an upcoming vacation plan within the U.S., should you consider canceling? And someone else wrote in about what about going abroad? I mean, people want to know how should this impact or not impact their vacation plans?
It's a fair question. I think CDC has recommended avoiding non-essential travel to China, Italy, Japan, South Korea, and Iran.
Okay.
So if it's not essential, avoid those countries for now. The CDC does not recommend restricting travels within the United States.
Okay.
Okay, good to know.
So that's good to know. All right, we got a number of questions concerning people who are already dealing with health issues, maybe receiving chemo or have other illnesses that they're worried about. So who is most susceptible? One viewer asked about her 80-year-old mother with cancer, for instance.
Yeah. So the most susceptible patients are patients who are elderly, who have an immunocompromised state, like patients who have cancer, patients who have chronic medical conditions like lung disease, chronic heart disease. So those are the most susceptible patients.
Okay.
And Teresa is asking, are there over-the-counter medicines that we can take just in case? And that sort of leads to, treating the symptoms, but there's a bigger question. There's no cure for this right now and no vaccine, right? Can you sort of update us on where all that stands?
So that's correct. There is no vaccine. There's been some trials that are going on, and I would assume it will probably take 12 months or more to develop a vaccine. There's also no curative medications. There's no Tamiflu for influenza. So there's no antiviral medication for coronavirus. The treatment currently is supportive, such as for fever-reducing medications and symptom management medications that you can obtain from over-the-counter.
And because let's go back to some of those symptoms. When we talk about if you have something that affects your lungs, like a COPD or something like that, this particular virus really targets the lungs. That's where we can see some of the big problems, right?
Yes. So patients who have COPD have exacerbations sometimes of COPD with the virus, and they should seek out medical care from their physicians or primary care doctor or pulmonologist. In those cases, there are additional medications that their providers can provide for symptom relief.
Okay. Is there anything else that you think people should know about this that we haven't covered?
I think I would advise and recommend everyone to stay calm. Right. It is a serious disease that can cause death, but most of the cases that occur are milder.
Okay.
In nature.
We want to thank you so much. Really, it makes such a difference to have the information and to have you come in. We really appreciate it.
Coming straight from your mouth from a health expert, so we appreciate it. Thank you. And we can't get to all of the questions. We had so many submitted on our Facebook page, but thank you for submitting them, and thank you to our expert here to explain a little bit more about all of this and what we can do to prepare ourselves.
Absolutely. We'll keep watching for our Eye on Health series here on PTL. It normally happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.